For this assessment, all measurements will be taken on the right side of the body. Mark all sites with pen or marker. To take proper measurements, pinch above or below the mark. Do not pinch muscle or skin only. Place caliper 1 centimeter away from the thumb and index finger. Measure halfway point between crest and base. Take reading within 1 to 2 seconds. Take duplicate measurements at each side and retest if duplicate measurements are not within 1 to 2 millimeters. Rotate through measurement sites or allow time for skin to regain normal texture and thickness. The 7 sites are triceps, subscapular, suprailiac, chest for men or pectoral for women, abdominal, mid-axillary, and thigh. The chest/pectoral measure is a diagonal fold. 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women. The triceps measure is a vertical fold on the posterior midline of the upper arm, halfway between the shoulder and elbow, with the arm held freely to the side of the body. The subscapular measure is also a diagonal fold, 1 to 2 centimeters below the inferior angle of the scapula. The mid-axillary measure is a vertical fold on the mid-axillary line at the level of the xiphoid process and the sternum. The abdominal measure is a vertical fold 2 centimeters to the right of the umbilicus. The suprailiac measure is a diagonal fold in line with the natural angle of the iliac crest taken in the anterior axillary line and immediately superior to the iliac crest. Lastly, the thigh measure is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the hip. Use one of the following 2 equations to calculate body density for either man or woman. The following 2 equations are used to calculate body fat percentage by using body density.